When you take your dog to the local vet or sit down in the chair at your neighborhood dentist, you assume you know who you are paying. A local business owner, someone who lives down the street, trying to make an honest living, running the kind of place that has been on that corner for 20 years. Increasingly, you would be wrong. And the numbers behind why are bigger than almost anyone realizes. In 2010, roughly 1 in 10 American veterinary practices was corporately owned. Today, corporate consolidators control somewhere between a quarter and a third of general veterinary practices, and over 3/4 of specialty and emergency animal hospitals. Private equity firms alone poured more than $51 billion into the veterinary sector between 2017 and 2023, with billions more flowing in every single year since. This isn't unique to vet clinics. The exact same playbook is running in dentistry, emergency medicine, nursing homes, ambulance services, even car washes. Private equity as an industry now manages somewhere between $4 and $7 trillion in assets globally, depending on how you count it. That is larger than the entire economy of every country on Earth, except 2. So, what is this playbook exactly? It is called a roll-up. A firm buys dozens, sometimes hundreds, of small independent businesses in the same industry and quietly merges them into a single, unregulated network. All without ever triggering the antitrust scrutiny a single mega-merger would attract. 50 small acquisitions in 50 different transactions rarely draws the same regulatory attention as one large one, even when the end result is functionally identical. Here is the part most people never see: how these deals get financed. A private equity firm rarely buys a business with its own cash. Instead, it uses what is called a leveraged buyout. Say a firm wants to acquire a $10 million veterinary group. Instead of paying $10 million of its own money, it might put up $2 million in equity and borrow the remaining $8 million as debt from a bank or bond investors. Here is the mechanism that surprises people: that debt does not stay with the private equity firm. It gets legally transferred straight onto the business that was just acquired. The vet clinic, the dental group, the nursing home now owes the debt for its own purchase and has to generate the cash to pay it off, plus interest, out of its own daily operations. To service that massive debt, the new owners cut costs. Staffing gets reduced. Prices go up. Services that weren't immediately profitable get completely eliminated. This is not an accidental side effect of the strategy. It is the strategy. The business itself becomes the vehicle that pays for its own acquisition. This isn't theoretical. In 2021, researchers from NYU, the University of Chicago, and the University of Pennsylvania published a study in the National Bureau of Economic Research examining 12 years of nursing home data covering more than 7 million patients. They found that private equity ownership increased short-term patient mortality by 10%, translating to roughly 20,000 additional deaths over that period. The mechanism behind that number is almost mechanical in its cruelty. After a buyout, interest payments on nursing homes more than tripled. Cash on hand dropped by nearly 40%. Staffing hours fell, particularly among frontline nursing assistants, the people who spend the most time on direct patient care. And use of antipsychotic medication, generally discouraged in elderly patients, rose by 50%, likely to manage residents with fewer staff available to actually care for them. This is what happens when a business optimized for community care gets restructured to optimize for debt service instead. The patients didn't get sicker. The business model changed underneath them. Private equity firms don't plan to own these businesses forever. The standard model is to acquire, consolidate, and exit within 3 to 5 years. Selling the now larger network to another firm, or taking it public at a significantly higher valuation than what they paid for the individual pieces. In veterinary care specifically, the math is stark. Firms typically acquire individual practices at 5 to 7 times earnings. then sell the consolidated network at 12 to 15 times earnings. That multiple expansion, buying cheap and selling at a premium simply for being bigger, is where a huge portion of the actual profit comes from, independent of whether the underlying business got any healthier. The long-term health of the business, or the community it serves, is mathematically irrelevant to that trade. What matters is whether the numbers look good at the exact moment of sale to the next buyer down the line. So, is this predatory, or is it just how capital markets work? The case for private equity's defenders is real. Many independent practice owners are aging out with no succession plan, and no buyer besides a corporate consolidator. A retiring vet or dentist with no children willing to take over the practice often has exactly two options: sell to a private equity-backed platform or close the doors entirely. Private equity offers immediate liquidity, professional management, and capital for expansion that a small local business often cannot access on its own. Some roll-ups genuinely do modernize outdated operations and keep struggling practices alive that would otherwise have simply shut down. The critical view says none of that changes the underlying incentive structure. When a business's ownership is optimized for a 3 to 5 year exit rather than long-term community service, cost-cutting and price increases are not a corruption of the model. They are the model, working exactly as designed. The data on mortality isn't an isolated failure. It is what happens when debt service becomes the primary obligation of a healthcare provider ahead of the patients it was built to serve. Both of these things can be true. Private equity can solve a genuine succession problem for retiring owners, and simultaneously restructure incentives in ways that measurably harm the people those businesses are supposed to serve. The next time your vet bill is higher than you remember, or your local dentist suddenly has a new corporate name on the door, or the friendly staff you used to recognize has completely turned over, it is worth asking who actually owns it now, and what they are planning to do with it in the next 3 to 5 years. This is the same pattern we have traced before on this channel. Systems that look local and human on the surface, running on a financial logic that most people never see. The dollar bill in your wallet, the bank that holds your paycheck, and now, the vet clinic taking care of your dog. All of it sits cleanly on top of a financial architecture built somewhere else, for reasons that have very little to do with you, and everything to do with a spreadsheet timed to a 5-year exit. If you want deep, data-driven insights into how business, economics, and the systems that shape how money actually moves operate, subscribe to Bold Ledger and turn on notifications. I will see you in the next breakdown.